Welcome to the Saturday Salon. It's a podcast that has been going for 6 years weekly. It's for global leaders, but now we have opened it up for everybody, so welcome. Today's guest is Dr. Edmond Fernandes, a doctor, author, and a public health leader from India. Welcome, Dr. Fernandes, and happy Independence Day of India.
Thank you so much, Soulaima. Pleasure to be here.
And you're traveling, and thank you for making time. It's 9 p.m. local time in India, so it's around dinner time. How did you celebrate Independence Day today? How do you celebrate Indian Independence Day? What is it like?
Independence Day is just a reminder of what it means to be free. And otherwise, I think collectively we should celebrate Independence Day every day because you only appreciate freedom truly when you don't have it, And this is a gentle reminder that 80 years of struggle of our freedom fighters. And it's something we're free. And that should be a reason to celebrate every day, I believe.
Well, actually that made me think of when you said freedom is something we appreciate truly if we have not always had it, You always appreciate what you don't have or are not used to. It's like that with everything. And that actually leads me to maybe my first question, health. Right? You are obsessed about health and how to make sure that people stay healthy and not become sick. Because actually good health is maybe something we don't appreciate until we don't have it, right? Once we get sick, I think there's a quote said, health is like a crown that only the ill person can see. When I'm walking around all healthy, I might not appreciate that I'm healthy, but someone that is sick and not healthy sees my crown, So how do we keep people healthy before they become seriously ill? And why are you obsessed with this question? And what do we not know about India? What is India doing in terms of preventive care? And if they don't do enough, what should they do more of?
No, so it's a perfect question on Independence Day. And while Independence Day would mean the political freedom based on a geographical boundary, it also, when you connect it in the larger scheme of things in health, it's freedom of diseases. And that's what makes preventive health particularly meaningful, essential, and important because we only appreciate health when we get disease. And otherwise, it's something taken for granted. And this is also about how nation building works. You often appreciate freedom only when you lose it, or if there is a war, or if there is some kind of curfew. And otherwise, you don't really care. And what's more important is that health per se shouldn't be a matter taken for granted, but rather it should be an act of self love. It should not be a luxury that's given, but it should be something that's embraced. And a lot of countries, while they've been investing in curative healthcare, in addressing diseases, I have not seen many countries who've tried to address preventive health actively as a governance mechanism. Whereas there's enough writing on the wall that the economics, particularly health economics, would tilt in favor of savings if invested in preventive healthcare rather than curative healthcare. And this is what surprises me because even global health diplomacy does not talk this kind of conversations. On one hand, you have big pharma who's promoting medicines. On the other hand, you have governments who are having policies that push for curative health. You have medical tourism, which also addresses that to a large extent. But why not talk about reversing potentially preventable diseases? Why not talk about building a generation of people who grow up healthier, live longer, and have a better quality of life? And that's the kind of narrative we need to control today. In a recent workshop, I'd asked participants, would you want to die peacefully in the comforts of your home, or would you want to die in a tertiary care hospital, pushed tubes, ventilators, needles, and injections in a hospital environment? And 99 of them said, I would want to die peacefully at home. And what are we doing from a policy perspective to enable people who go into old age and who eventually would die at home peacefully? There's nothing being talked about it. You take any country for that matter, absolutely nothing. And that is a pain point we need to think through about how are we really building the economies of the world? How are we building trade policies? How are we building global health diplomacy that positions human development and human beings at the center of it all?
Why do you think that no country has figured this out? Why?
Because healthcare is not a vote bank subject. You don't win elections based on healthcare mandates. Even more problematic is that you have money, you go to a best physician, you go to a best healthcare provider, you get your work done. But if we look at statistics, 8 billion people on the planet and 4 billion do not even have affordable healthcare. And nobody seems to be worried about it.
Well, I'm an American citizen. I'm a Danish citizen and an American citizen. So I've seen both. You have the social medicine, the free healthcare. And then on the other hand, you have insurance-driven private healthcare. That benefits to both. A lot of Americans are wishing for a system like Denmark until they realize that then you actually do need to pay your taxes, a lot.
True.
So what do you think the future of healthcare is? And let me ask one more question in that question, if it's okay. Do you think that AI can help speed up diagnosing, preventing, and cure?
For sure. I think AI could complement the process of how healthcare is driven today, but it should not serve as a model to replace the medical mind. But over the years, with increasing technology, what I have come to observe is particularly concerning that physicians in training are moving towards AI and trying to rely more on AI rather than their own inherent medical wisdom built on years of training engagement. Because a patient comes to us with two questions: what can you do for me? The second question is, what can you learn from me? And as a physician, if we don't address these two questions from every patient we meet or encounter, artificial intelligence cannot do that for us. And this increases our dependency on tech day by day and day by day, so much so that we would suffer from intellectual bankruptcy thanks to AI. And that remains a sizable concern right now.
Yeah, I like to call it digital Alzheimer's, You do teach future generations of doctors, the young doctors, and you have worked with organizations like UN and the Atlantic Council, just to mention a few. You see this, right, happening as we speak with the younger doctors, or are they more aware to stay human and use their intuition and network and medical training?
It's a mismatch of different kinds of people who come from different circumstances and backgrounds. But eventually, it becomes an act of convenience. And if you have an app which is giving you the diagnosis, if you have some kind of digital parameters that helps you enable interpreting diagnosis and guidelines, I think most of them would prefer outsourcing their brain to that and go the easier way because makes life much more easier. Take, for example, back in those days, we would read an ECG using the full-fledged waves. Today, you have machines which tell you exactly what kind of rhythm it is, what is the problem in the ECG, what is the diagnosis moving towards. So gone are those days when you had a physician who would read the PQRS intervals to interpret what the patient's condition is. And how are we going to really bring them back to that anymore? I really don't see a future that would bring them back to those clinical skills which were embraced way in the 90s and the early 2000s.
This is an incredible conversation, and I feel at my core that I'm now getting worried on behalf of the future of healthcare. You have written more than 5 books, 250 plus articles, and over 25 scientific papers. You're very productive. One thing, and I haven't read them all, I wish it's on my to-do list, but I do see a red thread through everything that you speak and talk about, and that is that good healthcare actually should begin in communities and not only at hospitals. Can you tell me a little bit about the community thinking? I think that's very interesting that you think that good healthcare starts in communities. I assume it has something to do with human nature and who we surround ourselves with and how we are social and those kind of things. But maybe you can unpack that a little.
So at a community level, I increasingly find today Dr. Google, or at least Dr. ChatGPT. So everybody you interact with, the next question they put forth is, but I checked this up on Google and this said this thing, Gemini said this, and ChatGPT said this. So now you are dealing with a generation which has access to information, not necessarily the right information, or at least the interpretation of what it could be. Because healthcare is an art. And there is nothing called a concrete kind of diagnosis. Every human body is different, responds differently, and needs a different kind of care and attention. And at the heart of it, every good clinical physician would tell you this. If there is somebody in the healthcare fraternity who says this is wrong and everybody should be looked at from a common lens, that this is the diagnosis, is a finite truth, then I think they're not listening to the age old wisdom, age old science that modern medicine has evolved through the 19th, 20th, 21st century. When we look at it in retrospect, what medicines that came out as a marketing publicity, many of them have been withdrawn by these big pharma companies. Take, for example, even COVID. When COVID vaccinations came, there was so much hype, there was so much hope. Be that as it may, that was necessary given the way people were dying. But now, when the situation is normalized, questions are being raised as to, okay, post-COVID complications, post-vaccine complications, who do we blame, whose neck do we catch, who do we sue? So uncertainty is the certainty which modern medicine brings to the core. And balancing this at a community level would really require understanding the humanity of modern medicine, understanding the limitations of it, and going back to what a grandmother's common sense would deal with back in those years, saying that, okay, if you have fever, just do these things. So, physicians today working at a community level or at a tertiary hospital level need to have that humanity intact, saying that anything that can be done to reduce the burden of disease with limited medical interventions would be a best case scenario, rather than just fueling the patient with multiple medications and then trying to see what would work. And the flip side of it, increasing number of patients today turning out to a physician either have half antibiotics, which they have just procured from a pharmacy, or they get it out of convenience. And then they come. In fact, as early as last week, I had a patient who had already taken a course of antibiotic and then came to me saying that I've taken these medications. It's not worked. I don't know why it's not working. But actually, the patient has taken the wrong antibiotic. And then I had to change the antibiotic. Within a day, the patient started showing signs of recovery. And now the next time the patient is thinking that probably both these antibiotics can be taken together. So it's a comedy of errors as well. And what we don't know is we're creating an iceberg complication within the human framework. So when the patient really would need these antibiotics in the future, it would not even work. And then what would happen is they'll say that doctor, it's not good. Don't go to that doctor. The medicines won't work. So at the core of it, medicine is at a crossroad today with clinical wisdom and artificial intelligence, which would serve either to complement or to confront. Which way we take it depends purely on how we would want to move forward with that.
Thank you for explaining this so well. There's so much ancient wisdom in Indian Chinese medicine, right? That we somehow is throwing out with the bathwater. At least my grandparents, they could cure pretty much everything just with the things they had in the kitchen, honestly. It was just a miracle almost. You are also very, very involved in climate and sustainability. And many might be surprised that you are. I'm just curious, is it because you feel like there's a lot of answers to our future problems to be found in maybe the oceans or the forests or locations that are being harmed by sustainability and changes? Or is it of other reasons that you are such an advocate for sustainability? And does your background as doctor bridge that interest, or is it two different things, not associated?
Climate and health is interlinked. Only thing is, since we work in silos, in isolated frameworks, both at a very high level within government frameworks and also at the UN, nobody really feels very committed to integrate the art of climate, health, food security, agroecology, and environment. Because who is a human being and what is a human body? It's nothing but part of an environment. In fact, I'll tell you the story of a family which suffered through COVID. The breadwinner at the house lost his job because of COVID and lockdowns. Then came the onslaught of extreme weather events because of climate induced changes. Severe flooding led to floods in the locality. After the floodwaters receded, there were small pockets which had the floodwaters. This led to breeding of dengue mosquitoes. And then this person was bit because of the mosquito and then had dengue, which eventually reduced his platelet count. And he had to be admitted to the hospital, replacing platelets. And his wife had to run pillar to post to get blood from the blood bank. They had two young children at home, so 2 square meals became 1 square meal a day. Job loss had a direct consequence on the family pocket money that would come in. And the children who were eating 2 meals then ended up eating 1 meal. And they went directly back into malnutrition. And then the vicious cycle of malnutrition, food insecurity, droughts, floods, economics of it. So what really happens with climate? It consumes the human soul at the very core of it. It does not spare a rich person, it does not spare a poor person. But as a physician who's able to see through this firsthand, integration of line ministries across governments is the only answer to addressing the burden of environment, climate, and health. Because today's physician is not prepared to interpret the outcomes of climate change on a human body. We've been trained to inspect the human body, to palpate the human body, to auscultate the human body and diagnose a disease. We've not been trained to understand whether this human body is having certain symptoms as an offshoot of heat waves, as an offshoot of cold, as an offshoot of an environmental consequence. That's not a normal training you get in med schools, whether in India or anywhere in the world. In fact, it gets even worse because diseases endemic to one particular country would not be understood by physicians in another country. So I had a friend of mine who acquired malaria in India, landed in the US, and by then he went into coma, was in the ICU in the US for about 14 days. Doctors in the US could not diagnose malaria because they never had it up in their mind until somebody after a few weeks said, "Why is he not responding?" And someone said, "He came from India. Could it be malaria? Have we tested for it?" And then they were like, "Okay, let's get that done." And it was malaria positive. So unless we really think through about how the patient comes in, We're not understanding policies. We are not being prepared at a ministerial level. And these are going to be consequences, not just for one country, because disease is no longer confined to one country, but is transboundary.
I see that. I see that. I almost lost my dad to a very bad malaria many years ago when he returned from Africa back to Denmark, and they had no clue that he had malaria. So I really understand that scenario. It's very real. In your book, Small Things That Matter Much, what is the one thing that people can do that actually makes a big difference for themselves? Because I understand that on a level of systems and internationally and partnerships between countries, we could do much better. But what can I do? What is it that I can do? Stop smoking, not drinking, exercising, sleeping better, have good friends. What else can I do?
Inner engineering. So small things that matter much is all about what are we chasing in life? And the crux of that book serves to tell that walks in the park, picnics by the waters, the chirping of birds, rosy sunsets, the best things in life are free. And what are people doing today? Chasing money, chasing recognition, chasing fame, hatred, vengeance. The world is filled with examples of it. And the book, although it was written when I was 19 years old, it was also written for my own sake as to what kind of a person I want to be. And at the heart of it is you have two options in this world. One is you chase the path of free things, which is given by God, or you chase human induced things, which peddles greed after greed after greed. The choice is ours. Either which ways, the time is temporary. We are here for a temporary time on earth. Whether we realize it or we don't is a secondary matter. But if I am to leave you with a answer, it would be the best things in life are free and don't chase anything material.
How much have spirituality led you in your career? And let me just make sure that everyone understands you're one of the most awarded doctors in the world, okay? This is not a small thing. So how much have faith guided you and helped you through some of the thousands of difficult decisions you must have made throughout your life?
I think faith has been that kind of everyday hope which guides my path. I mean, you can conceive God to be under any religion, under any name, and it really doesn't matter. But look at this, if I am to give an analogy from healthcare, 8 billion people on the planet, not even one person's fingerprints match. This is not a work of human being. This is a work of the divine. Not even one person's fingerprints match. Not even one person's DNA matches. And who do doctors turn to when everything is given up in the confines of an hospital? You can be the best in science. You can be anybody under the sun. But if you don't have the mountain moving faith that guides your spirit forward, you've lost the game. And no matter what you achieve in life, it's not your achievement if it was not meant for divine will to be. My own example here, we would not be talking today if I was not part of the YGL. This is neither my effort, this is neither your effort. It's simply a question of divine will being manifested. And this cannot be explained by science. This cannot be explained by philosophy or by mystery. It is just something meant to be. And the more scientific somebody gets, the more spiritual they ought to be. Because science does not have the answers.
In fact, friends that are deeply into science, they actually know that they tell me that faith and hope is driving them because they actually don't know. They don't know. They hope that whatever they are set out to do will work, but they have no clue. So sometimes I feel like those in science are the most spiritual ones, maybe even religious, and maybe that's the same thing. God knows, but it's true. And also one thing that we don't talk enough about is that we just came out with a report from the World Economic Forum, and over 80% of the world's population is associated with one faith in one way or another. But it's one of those things that we don't talk about because, we'd rather want to talk about our PhDs or our masters or awards instead of what's really materializing us as human beings. So that's interesting. Do you think, Doctor, if I may, honestly, have you seen that people who are going through illness, I don't like to say they have been cured by their faith because that might be borderline, I don't know, but is it helpful when they go through hardship to have something to rely on and believe in? Is that helpful when you go through a hard time with a difficult disease?
Well, absolutely.
Have you?
In fact, there is growing scientific evidence which points out that those people who pray or who listen to kind of some prayerful songs and hymns or anything like that have direct impact at least to 70 to 80% on their body, on their response mechanism, and on their healing. This is science. There's perfect linkage of direct faith and the way you respond to all the problems of the world. And those who don't are some of the most frustrated people on this earth, trying to throw stones at every possible corner and not being satisfied within themselves. So it's about a marriage of faith, discipline, worship, and humility put together of who a human being is. I mean, scientifically, we have a lot of names to it. You call it afterlife, you call it hypnosis, you call it psychology, you call it logotherapy, you call it anything you want. But simplifying it is simply being a good person to the extent you can be, surrendering yourself to the divine, and having that prayerful faith with constant guidance of seeking. If you're a seeker, you will achieve your answers. And the God who has put us on earth today is a God who wants the best of us. So we can't be cherry picking, saying that when we've had the best time, why was it me? When we are having the worst time, why is it me? No, that's not fair. You need to have a balance of both. And faith calls for having a balance of both. I mean, take it this way. When you have a model that works, or when you have attained your highest level of degrees, that time we don't question God saying that, oh, wow, why was it me that you gave a PhD to? Why was it me that you gave this? Yeah, we're like on top of the world. We want it. We deserve it. We earned it. But if we are faced with some kind of illness, if we are faced with some kind of setback, or we're faced with some frustrating incident, then we have 100 questions saying, why me? I don't believe there's God. This should not have happened to me. And that's not really fair in a scheme of things. It's not fair to us. It's not fair to God.
I like that. You have to appreciate both the ups and downs and not only blame when things are hard and take the credit when it's going well. I like that. What has been the hardest decision that you have had to make in your work?
I don't remember any hard decisions that I've had to make because every decision is a decision. Whether it's the easiest of it or it's the toughest of it, you have to make it, you know? And sometimes it ends up where you put smiles in the faces of people. And sometimes it may be where you put somebody down with sad news and rejection. Either way, it's okay because it's meant to be. But at the core, what's most important is if you approach this decision with the right moral consciousness and empathy. Because what one thing I've learned being a physician is that you may be Indian, you may be Danish, you may be American, you may be anybody, you may be Christian, you may be Muslim, you may be Hindu, you may be Buddhist. The human blood is red in color. Our entry point to the earth has been common, our exit will be common, and nothing changes in between. If we realize that and we do our duty with due diligence on that, nothing on earth can shake or touch us.
I like that. And I also like the fact that you're paying attention to the fact that gratitude, humanity, being humble and appreciative and all of that keeps our system clean and overall maybe will less make us less ill. Living now 8 years in Silicon Valley also makes me realize that good healthcare, especially preventative healthcare, often is associated with wealth. You can go and have your blood work. You can go and have your scans. You can have your this and that. You can have someone cook your organic dinner. Let's have a 2-minute frank conversation about all of that longevity research. What is your feeling around this? Like, let's talk about that because it's a massive industry.
Absolutely. I think preventive healthcare is expensive, is at the moment the privileged domain of a few. But my years of work is pushing me to get it for the 8 billion people because we're we're in this together. It cannot be the privileged domain of a few. And how ridiculous it would be that, say, we have access to understanding our own DNA system, but the rest of the people on the other side of the fence cannot understand their own DNA system, and we call them brothers and sisters with love. That's not fair to ourselves. And this is where I believe governments must step in because the budgets of governments is much, much higher than budgets of any private hospital or private company. And that's what makes preventive healthcare meaningful. And if the government feels that, say, okay, it's not a priority, then at least create competition where you have multiple players coming in for breakthrough innovation and offering much more reasonable and economical services. That's where preventive healthcare must arrive at. I've seen so many people die and live on a daily basis over the years. At their bedside, they don't really ask about, okay, how did I get to this level of complications? How did I reach a multi-organ dysfunction? What they really do or seek is, could I have done something 10 years ago that would have saved me from getting here in the first place? And that's what modern medicine and preventive healthcare teaches us if we are willing to listen. Nobody on a deathbed wants to die, but they want to understand that could they have been doing something that could have prevented it? And unfortunately, we're not wanting to answer that question at the moment. And that's where I'm trying to push it hard as much as I can in all the small ways I can for all those who I can.
And thank you for your service, Edward. It's incredible. What about nutrition? I was just in China, and as you know, like yourself, I travel a lot. I've been all over. And I was in a 7-Eleven in China. The food they serve in China in 7-Eleven is very different from a 7-Eleven in Germany or in Moscow for that matter, you know. I don't know if they have 7-Eleven in Moscow, I realize. But rice, small things, you know, I have no clue what I'm eating, but it look healthy. Japan, same. Nutrition. What is being sold in the supermarket? Let me just say one more thing. If you go to US, of course, I lived in Austin, great supermarket, Whole Foods, you know. I live in Palo Alto, Whole Food, all good, organic, just from the fields because it's close by. We have good food production, lots of organic food. But if you live in many other places in US, fresh food is not something that is easy to get your hands on. An apple or a banana or whatever, you know, a cucumber. It's not available. It's really not available. Many people do not know that, especially those who make decisions because they live in the clusters of rich people. So they don't know, they have not been in those areas where fresh food is not possible. So what is India doing? Is India a role model? I mean, Indian food to me is street cooked, nice, spicy, hot, amazing. But has Indians also changed their eating habits and now eat more fast food and all that sort of crap?
There's this saying, few moments on your lips, forever on your hips. And that's what's happening in India today with an outbreak of obesity, fast food orders, colors being added to the food, pesticides added to fruits, preservatives being added. And the food industry is like a ticking time bomb, particularly in Asia and also the export markets for Middle East, for Africa, Latin America. And nutrition is playing a critical role in influencing a lot of lifestyle related diseases today. But the kind of food reaching from the farm to plate exercise is at times dangerous, and no ownership is there for that. So regulating the food industry needs focus. Probably this could be a longer conversation for the next time, because food safety, food hygiene, and also the components of what we are consuming have a direct impact on the human body. Take, for example, the meat market. How do you produce levels of meat to be consumed by humans on a daily basis? You have to inject the chickens and goats and all of them for them to grow, give them antibiotics, and then we consume all of that. Those antibiotics reach us, and we're creating antibiotic resistance. Now we are looking at also ultra processed food, which is having direct cancerous tendencies. We're looking at quick fixes, but what we are not looking at is what is the brain gut barrier and how is it programmed, because the gut microbiome is not understood, and this differs from country to country. And thanks to globalization, today I'm in India, tomorrow I'm in Dubai, day after I'm in New York, and I'm going to expose my gut to three different variants of food from three different cultures. Is my gut ready for it? Answer is no. Does medical science know about it? Is research taking place? In bits and pieces. So it's going to be a complex narrative in terms of how the food and gut interface is going to shape up over the years. That's why today you have increasing number of people suffering from irritable bowel diseases and also constant diarrheal problems. It's not because they're inherently weaker in immune systems, but it's just that their gut is gone for a toss and they've never tried it to fix it.
Yeah, it's a real thing. I really do appreciate that conversation. It's barely understood. I was taught by my grandmother, just eat a lot of different vegetables all the time. Never eat the same stuff every day. Just try to do variation, and that's easier said than done if you're poor, if you live in the streets, like you know, you have other problems, you're just trying to survive, you don't think about your guts, right? So it's also a privileged problem somehow. But I love the school food systems. For instance, in UK, they have really been trying to adopt more into the Japanese model of fresh cooking in schools. And, you know, I also think it needs to be part of the educational system. I know we're running out of time, and I want to make sure that you still have a little bit of the night to enjoy before you travel tomorrow. And I'm struggling to pick my question because I want to talk to you about women's health that is so poorly understood. I want to talk to you about what young people understand that older people don't understand about health. But I think my closing question will be, sadly, my last question, but I really want to pay attention to your time, and it's late. If you could change one thing about healthcare everywhere in the world tomorrow, what would that be? Just anything, and there's no limit in terms of budgets or anything, resources.
Initiate the for preventive healthcare in every country.
Mic drop. That's easy. That's simple, right? And that ministry should work across everything.
Absolutely. That would be working with line ministries, having a customized prototype, SOPs in place to look at a population, to look at a generation in which we can invest in. Not a protection mandate for 5 years or 10 years, but something with a serious policy, keeping the future of countries around the world at large. It should have come from the Health Organization, but to this day, it's never happened. So if it's left in my hands, Ministry of Preventive Healthcare is something to begin with.
I think you should create a council of ministers or politicians from around the world that all work across and with that mission in mind. And honestly, I'm thinking about Dubai a little bit, because Dubai has been one of the most innovative nations in the world in coming up with new ministries for this and that. They even have one for happiness, and they have an AI minister and whatnot, and many more. And I think they might likely be your first first one, I think, right? I envision if anyone would get a minister for preventive health, it would be Dubai. Am I completely wrong?
Well, I think it's safe to bet on Dubai, and probably we should take it to the UAE government together. But I think that's a ideal way to get started on.
Listen, my friend, it's been such a good conversation, and well, I know we don't have more time, but next time I would like to dive more into how you decided to become a doctor and how that journey has been for you when you were, because already as 19 you wrote this incredible book, and it must have been a very special journey, also for your parents and other adults around you to witness this obvious talent of yours and how you unfold it. So thank God for that. My friend, yeah.
Sure.
Yeah.
Just to answer that question that sets the tone for the next time. Before I wanted to become a doctor, I wanted to change the world. After I became a doctor, the world changed me.
That's very beautiful. That's very beautiful. That could not have been said better. Dr. Fernandes, thank you so much for spending your Independence Day with me today and your fellow colleagues from the global community, with the YDLs and everyone else who listened in and learned from you. Is there anything we can help you with? Anything we can help you with?
The true meaning of life is to plant trees under whose shade we may never sit. That's what Nelson Henderson said. So please feel free to help me start the Ministry of Preventive Health.
I think that's a very good call to action, and I like that analogy. Also build something big, knowing that you will never see it at the end and you will never enjoy the fruit of that, but still put in the work. I really love that. Thank you, everyone. I hope you enjoyed the Saturday Salon. Next week, don't miss that. We are here every Saturday, always at the same time on this channel. Thank you, everyone, for tuning in, and thank you, everyone.
Bye-bye.